Good afternoon, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday, April 5th update on the impact of the COVID-19 pandemic on Mobile County and how our vaccination efforts are going. So we continue to see a decline in the number of cases, hospitalizations, and deaths in Mobile County related to COVID-19. That is in contrast to some things that are going on in other parts of the country where you have seen some alarming increases in the number of COVID cases. But today we're reporting on a cumulative number of 37,701 cases of COVID-19. We added just 2 cases yesterday. That is next to the lowest number of cases reported. We learned about 1 additional death from COVID-19, bringing the cumulative number to 795. And the cumulative number of patients hospitalized with a COVID-19 diagnosis increased by 2 yesterday to 4,826. And the number of people hospitalized yesterday has gone up slightly from last week. It was at 19 yesterday. That last week we were seeing things down around 14 or 15, so that has inched up a little bit. Over the weekend, on Saturday and Sunday, we had 18 and 16 cases reported. So again, the number's fairly low. But just to remind you that we know that it's the young people, it's people between the age of 18 and 45. That's kind of our largest demographic. Those are the folks who are driving COVID transmission. They also are the last to be eligible for vaccine. So we are thrilled that vaccine eligibility has opened up to include people of all ages, 16 and over. So please do your part and get your COVID vaccine as soon as you can. And please take the first vaccine that you are offered. All of the vaccines are highly protective and very safe, so please sign up to get vaccinated. We have been down at the cruise terminal all day providing vaccine. We'll be there until 4 o'clock. Walk up, no appointment necessary. Again, no out-of-pocket cost to anyone who wants to get vaccinated. I believe they've done around 350 vaccines, first doses today, which is really good news. And yes, there is very conspicuously or very easy to see an increase in the number of younger people who came to get vaccinated today. So we're excited about that. The number of emergency department visits for COVID-like illness are still very, very low. I had mentioned last week that it appeared that they were creeping up a bit, which concerned me, but they are still very low. And the percent positive, so the percent of COVID tests that are positive is up slightly, but it's still very, very low at 3%. So that is still good news. And it's great news for our nursing homes too, because when the community percent positive is low, then some restrictions are lifted that allows more visitation with people who have family members and loved ones in nursing homes and long-term care facilities. So let's see, just a couple of other things to talk about today before I answer a couple questions. CDC has updated their guidance, their travel guidance for fully vaccinated people. So remember, to be an FVP, to be a fully vaccinated person, you have to have had a full course of COVID vaccine and it be at least 14 days since your last dose. So if you got the J&J vaccine, you are considered fully vaccinated if it's 14 days past that dose. It's just a 1-dose vaccine. But for the Pfizer and Moderna, it's 14 days past your second dose. That's when you make it into the FVP club of fully vaccinated people. And that allows you to have some liberties that we have not had in a very long time. For example, if you visit someone and if you visit another household and you're fully vaccinated and they're fully vaccinated, then you can visit without wearing a mask. We still want you wearing your mask when you're out in the community, just for extra precaution to slow transmission. So with regard to travel, uh, fully vaccinated people can travel, this again from CDC, can travel within the United States and do not need COVID testing or post-travel quarantine as long as they take precautions while traveling. So if you are fully vaccinated, again, 2 weeks after receiving the last dose of your vaccine, then you can travel domestically and you don't need to need COVID testing or post-travel quarantine as long as you're taking those precautions of wearing a mask and distancing and avoiding crowds when you're traveling. There also are some considerations for traveling internationally for people who are fully vaccinated. So fully vaccinated people can travel internationally without getting a COVID test before travel unless it's required at the country of your arrival, where you're destined to go. Also, fully vaccinated people do not need to self-quarantine after returning into the United States unless that is required by a state or local jurisdictions. But there's no federal restriction on fully vaccinated people returning to the United States. They do not need to self-quarantine. So, but if you are fully vaccinated and you're at an international location, you still are going to be required to get a COVID test before boarding a flight to the United States. So you need to get the test before you board, and then 3 to 5 days after returning for travel. And again, even when you're fully vaccinated, if you're outside of your household, you should always continue to take COVID-19 precautions while traveling, whether you're traveling in the community or in the United States or traveling internationally. Even if you're fully vaccinated, you still need to wear a face mask, physically distance, avoid crowds, wash your hands, all of those things that we talk about. Okay, here are some questions for April 5th. Someone asking if the health department has an opinion on whether people should have a COVID-19 passport. I'm not quite sure what that means, but documentation of your COVID vaccine is really important for you to have handy. Please, don't lose your card. If you do lose your card, we can help you get documentation of your vaccination. But yes, you probably for some time be a good idea for you to maintain the evidence or the documentation or the proof that you are fully vaccinated. Someone asking if we're expecting more people, young people, to come and get vaccinated. Yes. With the expansion starting this week, we do hope that younger, healthier people will seek vaccination. Let's see, a couple of questions about vaccine hesitancy. We are aware that of vaccine hesitancy. It's not just with this vaccine. Adults, I think, forget that they don't have polio or smallpox or measles because they got vaccinated when they were children, and they have been protected from those very serious conditions. So for adults, we just need to remind them that vaccines are safe and effective and very useful in reducing community transmission. So it's not just about reducing the risk for yourself, but also about reducing transmission in the community. But there are other reasons that people, hesitate. Maybe they have fear or anger or a lack of understanding. So we try to have those conversations to try to set aside fears, particularly fears, but also deal with some angers. We know that in our past there have been things that have happened where health has not been equitable and sometimes has harmed people. So we are trying to build trust, and particularly in minority populations and populations of color and lower socioeconomic status and lower literacy by really working with leaders in our faith-based communities and our minority communities to try to have those conversations so that we can reduce those barriers, reduce the fears and the angers and the concerns, so that we can get people the life-saving vaccine that is available to us right now. So it's really important that we are sensitive to concerns and that we work through trusted community members to try to get the message out about the importance and the safety of this vaccine. We're hearing that a lot of people really trust their pharmacist, someone, that they go to regularly to get prescriptions filled. It's where they go to for advice when they have a sick child, those sorts of things. And so we're super excited about the National Pharmacy Program and how much vaccine is available at pharmacies. So those are some of the things that we're doing at the health department and in our community to try to reduce barriers and hesitancy to take vaccine. All right, let's see. Do 16-year-olds have to have a guardian for shots at the cruise terminal? So in the state of Alabama, an adult for healthcare purposes for vaccination is 14 or older. So people who are 14 and older can decide to get vaccinated without a parent or guardian present. So you can sign yourself to get vaccinated. So if you are 16 and older, remember you can get the Pfizer vaccine, but Moderna and the Janssen or J&J vaccine is only authorized for people who are 18 or older. Someone asking, what do you need besides an ID to get the vaccine? That's really all. You just need to come and see us to get vaccinated. There is some paperwork that must be completed, but you don't need much. We have most of what you need on hand. And then someone asking if there's going to be J&J or Janssen vaccine in Mobile. There is already J&J vaccine here. I don't know all of the locations that have it, but you can look at vaccinefinder.org. And you can see that there are lots of places around Mobile that have J&J vaccine, Pfizer vaccine, and Moderna vaccine. So more on that later. So a couple of first vaccine opportunities that the Mobile County Health Department is offering this week. So this is our schedule for this week. Today we're at the cruise terminal from 8 until 4. Tomorrow, we will have a first dose Moderna vaccine at the Dauphin Island Sea Lab. It's actually at the Shelby Center, which is behind the Dauphin Island Sea Lab, 101 Bienville Boulevard in Dauphin Island. That is going to be tomorrow, April 6th, from 9 a.m. until 1 p.m. So this will be our second big event in South Mobile County. We're just super excited to partner with Dauphin Island mayor and other officials, and then to partner with the Sea Lab to get this Moderna first dose vaccination clinic offered at the Shelby Center behind the Dauphin Island Sea Lab at 101 Bienville tomorrow, 9 a.m. to 1 p.m. Again, no appointments, first come, first serve basis. And since it's Moderna, it will be for 18 and over. All right. Our other opportunity to get your first dose of Moderna messenger RNA vaccine is at Yorktown Church on 851 East Street in Mobile. What part of town is that in? I don't know. Yorktown Church, 851 East Street in Mobile. That is going to be Thursday, April 8th from 1 p.m. to 5 p.m. Again, Yorktown Church, 851 East Street, Mobile, on April 8th, that's Thursday, from 1 p.m. to 5 p.m. And again, that's walk up, no appointments necessary. So that is very exciting. And then we do have a second dose clinic that's at the cruise. You got the location? Plateau?
Community.
Plateau Community. Vaccine is coming to you.
Off Faith Ridge Road.
Okay. Sounds great. Thank you, Mark. All right, second dose vaccine clinic. Again, this is Moderna. So if you received your first dose of Moderna at the cruise terminal from the health department, then your next chance for your second dose is Wednesday, April 7th. So if you received your first dose on March 2nd, 3rd, 4th, 5th, 8th, 10th, or 12th at the cruise terminal, you need to come back to the cruise terminal on Wednesday, April 7th between 9 a.m. and 4 p.m. So again, you must bring your vaccination card. If you don't have your card, or if you've lost it, or if it's been, you forgot to bring it, we can look it up, but you'll have to wait. So please bring your vaccination card. So again, let me just sort of recap these, and these will all be available on our website at mchdcares.com shortly, if not already, and also on our recording at 251-410-MCHD. So today we're at the cruise terminal until 4 o'clock. Tomorrow at the Dauphin Island Sea Lab, the Shelby Center there from 9 to 1. On Wednesday, second dose Moderna at the cruise terminal from 9 to 4. Then Thursday, the next first dose clinic at Yorktown Church, 851 East Street. Again, that's Thursday, 1 to 5 p.m. Walk up, no appointments necessary. So I think that is all that we want to share with you today. Again, we are working hard to try to bring vaccine to as many people as we can, as quickly as we can. Sometimes we have to pivot and change our plans slightly when things don't work out because of Mother Nature or other reasons. But we're super excited to be, getting out into the community more to bring vaccine to the folks that have not been able to come and get vaccinated at the cruise terminal. So I will end there, and we will talk again on Friday, and I'll give you an update of where we've been all week, and again, try to implore your participation in helping us keep COVID transmission low in our community by getting vaccinated and continuing to wear your mask and staying at home if you're sick. All right, thanks everyone. We'll talk to you on Friday.